Lucy. So it is time for some hands-on learning, girl. Are you excited?
Yes.
Okay. So let's do a spirometry on our own, just so you can get practice on. This will give you a better demonstration on how to instruct your patients to do it whenever it's time for you to instruct your own patients, and also a chance to actually see the volume time graph. So we'll get you all set up with that. Let me get my gloves on. Now, have you seen one of these before? No?
This is my first time.
Okay. So here is the monitor. We're going to just go ahead and turn that on. We're going to hook this to the top, and this is what's going to give us our measurements. So we'll have a bacterial filter just for to keep everything clean and everything. You don't want to cross-contaminate anything from your patient, so you always make sure you use one of those.
Okay.
And nose clips, just to prevent any air leak through the nose. Some people have a hard time just breathing out of their mouth. They want to breathe out of their nose, so this will help prevent that.
Okay.
You can go ahead and put that on. So what you're going to do is you're going to take a nice deep breath in, and then you're going to make a nice tight seal around that mouthpiece there. Make sure you're not blocking it with your teeth or your tongue, and you're just going to forcefully exhale. So blow out as fast as you can, and it needs to at least be for 6 seconds. Okay?
All right.
All right, so whenever you are ready, you can go ahead and do that. Great, now breathe in. Perfect. Awesome. Okay, so you see how yours is in normal range, so within the 1 second you were able to exhale a little over 4 liters actually, so yours looks great.
Overachiever.
Overachiever for sure. Okay, so we'll do it one more time so that you can get a chance to get a little more practice in, okay? So whenever you're ready, we'll do it again. All right. Perfect. That was even better.
Was it?
Yeah. And it has like a nice round look to it. And if you notice in your COPD patients, it's going to have a different shape. So it's going to concave in more right here to make it appear more like a pork chop, whereas yours looks more like an upside down ice cream cone. Okay? So whenever we get to go do Miss Tubbs, you'll be able to get a better visual of how the COPD would look on the spirometry.
Yeah.
All right.
Now I understand a bit more on how spirometry is a valuable tool in diagnosing a COPD. How often is it checked?
Well, it's assessed on an as-needed basis. The goals of COPD assessment are to determine the severity of the disease, its impact on the patient's health status, and the risk for a future event, such as exacerbations and hospital admissions and death, in order to guide therapy. So assess the following aspects of the disease separately. So you're going to assess the symptoms, the risk, and the comorbidities. The symptoms are assessed by validating questionnaires, such as the COPD assessment test or the clinical COPD questionnaire. Those are recommended for a comprehensive assessment of the symptoms. The modified British Medical Research Council scale, it provides only an assessment of breathlessness. So let me show you a copy of that. I have a copy here for you. Okay. So you can look at that. The risk of exacerbations are also assessed. An exacerbation is an acute event characterized by worsening of the patient's respiratory symptoms that are beyond the normal day-to-day variations. And those worsenings lead to a change in the medication. The best predictor of having frequent exacerbations, which is categorized by 2 or more per year, is a history of previous treated events. The risk of exacerbations also increase as airflow limitations worsens, and hospitalization for COPD exacerbation is associated with poor prognosis with increased risk of death. Now, the comorbidities like the cardiovascular diseases, osteoporosis, depression, anxiety, skeletal muscle dysfunction, metabolic syndrome, and lung cancer, among other diseases, occur frequently in COPD patients. So these comorbid conditions may influence morbidity and hospitalizations, and they should be looked for routinely and treated appropriately.